The reason you know it's an acid-fast stain, you look at the blue background, you see the acid-fast gives you a red color. Okay? Now, Miss Penny, you know what that is? It's an acid-fast, but what is the name of the organ? Okay, in other words, in a patient, an AIDS patient with diarrhea, okay, we can do an acid-fast stain on the stool, looking for a parasite called Cryptosporidium. So this is a Cryptosporidium. In other words, it's round, not when we do the acid-fast stain and we're looking for a bacilla. In other words, the previous this is where we're looking for an acid-fast bacilla. In other words, if we do a close-up, you will see that the red organisms, if you see ones that are by themselves, if you look here, this is a bacilli, this is a bacilli, this is a bacilla, this is a bacilla. So in other words, it's red. In here you have a lot in here, but you can't see. You got to look for the individual organism to tell what it is. The blue in here basically let you know, you could use that as a jumping off point, that it's an acid-fast stain because the counter stain is blue. So once you see that, you figure then that's not a gram stain, because your gram stain would be giving you purple and pink. So right there you say, well, that's an acid-fast stain. You look to see if you see bacilli. But in the stain that I just showed you, so this is another stain. You notice that blue background and red bacilla. So that would be an acid-fast stain with an acid-fast bacilla. But if I come here now and you see, you still have the blue background, but you have those things in here that's round and look red, that's a Cryptosporidium. In other words, it causes diarrhea in AIDS patients.
So as long as you see a cocci that's acid fast, it's automatically Cryptosporidium?
That's not a cocci, man. That's, you see, the thing about it is,
the inside
is that if you look at the size of this, you don't have any bacteria that's that large.
Okay.
You don't have any, but if you look at it, with the blue background and the acid fast, we're talking about a Cryptosporidium. Because a bacteria is not that large.
Okay.
A yeast could be, not even the yeast is that big, except for maybe a Cryptococcus with a big capsule on it. All right? Go ahead, Ms. Santos.